Hello and welcome. Today we bring you back our successful candidates, scholars, and faculty member. We want to go through their journey. I have with me Dr. Smitesh Parte and Dr. Priyal Mehta, who will be sharing about USMLE. We promised to you all that we'll bring them back and then talk about what worked for them as a successful candidate who did the things by the book, matched, did research, good interviews, practices, and so on and so forth. So today's in this series, today's session is to talk about USMLE preparation. So welcome, Smitesh and Priya.
Thank you so much, Dr. Kashyap.
So before we start, or as we start, can you just share, like a overarching, like a 20,000 feet view, when it, in terms when we talk about USMLE exams and preparation, what is the one, two, or three major points worked for you overall when we think of it? Maybe I'll start with the Priyal first.
Sure. Thank you so much, Dr. Kashyap. Uh, what worked for us through the entire USMLE journey, I think, would be being dedicated. Sit for studying, sit for completing your question bank, sit for completing your videos every day consistently. I think getting habituated to the learning process, I think that is what took time for me initially. But once I got the hang of it, it was really easy for step two and step three. The question pattern is very different from what we were used to back in our home country. So that is something that takes time. So start slow, that is fine. But always remember to be consistent. Sitting one day and solving 100 questions and the next rest of the week not solving anything would not help. So I think that is what works. Simultaneously, knowing that where your weak spots lie, I think that you will come to know once you are going through the entire process. But keeping a note at the back of your mind, or just making a note that these are the topics that are not that I am weak at, I think that would also help. But hard work, persistency, and dedication, I think those are the key for the entire journey, and it stands true for the exams part also.
Smitesh, same question for you.
Yes. So I think I have 3 points that I would like to highlight. The first would be, as Dr. Mehta mentioned, setting up small supplemental goals. You have to divide your time. We have to complete these steps and exams in a particular time bound manner. So let's make sure that we have a timetable in front of us. It's okay to miss it, but at least have it. So that's important. Once you have it, you will try and follow it. Setting up small goals per week and checking them, that's how you keep a track on your progress. That, and then partner, some accountability partner, that helps. It's a long process, 1 to 3 exams. You might get lost on the way. Having friends, supports, and mentors is extremely necessary, especially for this exam. So that's my first and I think second point. The third would be, this is a different exam than what we normally have back in our home country. I come from India. So this exam does not focus on rote learning. You really have to go delve in the basics, learn the concepts, and then apply. So please follow this video and we can hopefully clear some doubts about how we go ahead for each and every step.
I think the couple of things you mentioned is very, very important. That the application piece. We may be used to of mugging up and then memorizing the facts and things like that. And USMLEs are not that much of memory. Sometimes they give you the result, they'll give you the diagnosis, they'll give you the lab values and all those things. Idea is how you apply. Either in diagnosis, alternate diagnosis, or management piece of it. So that's very well taken that point. I think let's deep dive into each steps and see if you can walk through our viewers for a step one, step two, and a step three. So take it away, whoever wants to share their screen and then talk about it in that fashion.
Um, can I start?
Yes, go ahead.
So, we want to present the do's and don'ts for USMLE for our viewers. So, the first one would be one, one second. The USMLE do's and don'ts. Let's go through each exam, and I think that would help us to dive deep into how we can make this better for our future applicants. So step one, um, we from our experience we have gained some pearls of wisdom, if you may say that. But these are some things that we would like the future applicants to keep in mind. First is set a date and try to stick to it as far as possible. Having a target in your mind will help you be driven and motivated and complete your tasks in time. So do not procrastinate. Once you have the date and you have set it, please stick to it. The second one would be choosing one source and going with it. I have seen a lot of my friends and juniors who try to do multiple sources. They try to complete boards and beyond, they try to complete Kaplan, they try to make Anki notes, they try to do Pathoma. And all these things are only going to make it more difficult for you to learn the concepts, because every source has one thing that is good about them and the other thing that is too heavy to learn. Pathoma, for example, it is the basics of patho that is good to know, but we don't need to go into that much detail. Second would be supplementing it with sketchy for microbiology. Pictographic learning, I think, is very important. That has helped us. So I would highly recommend doing sketchy for micro. Third would be first aid. As everyone knows, first aid is the Bible of step one. Without first aid, we cannot pass our exams. But supplementing the first aid notes with the UWorld question bank notes, I feel is going to help everyone and make it easier to revise in the end. Using free 120s, the NBMEs and UWSAs as a checkpoints in your entire journey to gauge your level of preparedness would help you. So I think this would cover, it should take as long as you want, but try to set your targets and try to achieve them. Third, as we already mentioned, having an accountability partner would help you stay in track and keep a check on your progress. But that being said, do not be hard on yourself. Take short breaks whenever you require them. And always focus on conceptual learning rather than rote-based learning. That is the key, and that is what I think step one helps us with. So, Smitesh, I think I would like you to do the step two.
Sure. So step two is a completely different ball game for step one, and I think that's why a small break between step one and step two is warranted, because the same formula that I used for step one did not work at all for step two. So let's start with the first thing. Step one, it's a lot of concepts, basics, micro, patho, and graphs and charts. Step two is all about algorithms and clinical scenarios. So the first and the most important advice that I would like to give is revision is the key. You need a dedicated study period at least a few weeks before the exam. Step two is something you complete at the end of your med school or after your med school. So most of us are working or most of us are busy with our internships, but please keep some period of time dedicated before the exam. This helps you get right in the groove of practicing MCQs. Step two is a long exam. It's a 9-hour long exam. So real-time mocks in which you're sitting for 6 and 7 hours continuously and consistently help you. They help your brain get attuned to the levels of attention and concentration that you will face in real exam time. As far as study materials, UWorld is undoubtedly the gold standard. You have to complete at least one pass of UWorld while making your own notes, because these small tips come together in the end, and this is what helps you for the revision. What I found, again, it's a personal suggestion, AMBOSS, Hammer 3, 4, and 5. These are the tough questions for AMBOSS. You can supplement them with UWorld, or if you have a crunch of time, use these only for your weak subjects. This is how you have a well-rounded approach when it comes to studying. And again, for step one, NBMEs, UWSs are very predictive of your exam scores, plus minus 10, but they give you a good picture on how deep the water that you're standing. That will help you plan the next phase of your journey before giving the exam. Again, accountability partner, more important than in step one. Step one is pass fail now. step 2 has a score. So there's always that added pressure in step 2, which is exactly why we don't study for scores. Don't keep a particular score in your mind at 260, 255. Just keep on studying until you know that your notes you have revised and you have memorized them to the best of your ability. As you keep on revising, your scores will consistently increase. And this is what I've seen, not just with my experience, but plenty others in NBMEs and UWSAs. And lastly, something which is very important with the current NBME case scenarios, be true to yourself. Do not fall for recalls or recently asked questions or notes. There's a lot of these going on in a lot of social media platforms. This is the one of the toughest exams of your life. I think being true to yourself is a part of journey that USMLE warrants. So that would be my last advice. Study yourself, and I promise you, you'll get to this exam through sheer hard work only. Priyal, for step 3.
You. Uh, so step 3 is an exam that you generally plan for before, like people tend to give it during the first year of residency. But what I would advise and what our experience has been that taking the exam before starting the residency, generally by the December of the math season, would help you. It will help your application. It will help you stay in touch with the clinical aspect while we are giving the interviews. The other thing is do plan to take the exam at least one after doing one rotation in the US, because step 3 is system based exam. You have to know the system because it also has one part of the CCS cases that you would know only after being in the system at least for 1 month. So this would be our advice. For the study material for step 3, UWorld question bank is we completed the UWorld question bank at least once before giving our exam, and that really helped doing the entire question bank. For CCS cases, we practiced it on ccs.com. We found the cases to be very similar to what we found in the exam. The pattern, the UI of it was very similar. And we gave one NBME, one UWSA, and we completed free 137 to gauge our level of preparedness. And that was like quite similar to what we got in the exam, plus minus 15, 20 marks. But we knew that where we lay and how much more practice we needed. During the preparation, when we were solving question banks, setting aside 1.5 hour in the night to do at least 10 to 15 cases, short cases and long cases, helped us to complete our target within that set amount of time. Creating a chart, because when you are solving these cases, you tend to forget very basic orders. So creating a chart and memorizing it before going to the exam helped us. And what I would recommend personally is keeping at least 1 day of exam between the 2 days, so that you can come home, you can have 1 day to yourself, and you can again start preparing for the other day. So thank you so much, Dr. Kashyap.
No, I think this is fantastic. If you don't mind sharing your screen, first of all, very nice and very kind of you guys to share this with the viewers and then the people who are watching it today. I want to highlight a few things what you have mentioned and maybe seek some input from you as well. But before that, disclaimer that this is the scholars, they are sharing their personal experience. They're sharing what has worked for them. It may work for you, it may not work for you, but this is something which I have seen consistently. Many things Dr. Parte, Dr. Priyal has, Dr. Mehta has mentioned, these has worked out for people. This is a sheer hard work, planning, strategy, and dedication. Nothing can beat getting higher scores in USMLE exams or passing exams or getting desired score for that matter. It doesn't mean that you follow this and you'll definitely get it. You know, either our scholars and GRRSP and myself, we are not responsible. So this has a disclaimer. This is something to share their experience and then see if it works for you. And then everybody has a different learning pattern. So just be aware of your learning pattern and then try and test what works for you. Smitesh and Priyal, you have shared, journey of step 1, step 2, and step 3, and then, you're having accountability partner, having, going through the questions and then revising and things like that. Tell us to the viewers there'll be a time you can't be upbeat all the time in this journey, especially USMLE step 1 and 2 and 3. So were there times where the feeling of hopelessness, despair, or what we're doing it, nothing is working, and if so, how did you overcome and then kept going for that matter? So any thoughts on that?
Yes, 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 yes. I have had some, I'll be honest and open about it. It's a long exam, 3 years, step one, two, and three. So I think this was around step two, before like a month and a half from the exam, that I started feeling really hopeless. And, I was burnt out. I think that's the right word, because I have been continuously studying. I took a break from my job. So I was out of touch with clinicals, and I was just doing MCQs one after another. And this is what the exam demands. So it became really tough at times. And I think the first step would be identifying that you're not making any progress. Just sitting in front of your computer and solving what 40 a block a day is not going to help you. So I think identifying that there's a problem is the first step. The second would be to actively and openly seek help. It can be your accountability partner, it can be your real life partner, or it can be your family or friends. But I strongly advise, do go out with them. Seek help, distract yourself. It's okay to take a small 1 week break in between. I personally went out and took like a 3 day vacation. Just took my car out, drove around, refreshed myself, and came back. It helped by leaps and bounds. That would be my second advice. And third, this can occur again in step three also, because there's clinical and you have your math season possibly. So again, lot of factors. The stress levels are always going to be high. So please do not let go of those friends and support and mentors that you have had. They are very, very key to solving this exam. And at the end of the day, we are physicians. We have to work in high level exams. So believe in yourself that you have come this far, you will go ahead. So I think that confidence that your mentor gives or your peers give is extremely important. So something to always keep in mind while going forward.
Real, your thoughts?
I agree with Dr. Pate that having a strong support system is something that will greatly help you during your entire preparation and possibly even during your residency. But one thing that we have to recognize is that this is something that is going to be like a character building approach for you. It is something that is going to teach you perseverance. It is going something that is going to teach you how to deal with stress, how to deal with emotions, how to deal with uh, not knowing where something is going, but just believing in the process. I think that is something that I took away out of this journey. But of course, seeking help, even professionally, is something, if that is what you need at the moment, is something that we would highly recommend. But always talk about it. Talk about what you're facing. Talk about it with your partners. Talk about it with your mentors. Talk about it with your family. But don't forget that this is a part of your life. It is not your whole life. So you can always give it again. You can always supplement your scores with something else, with research, with job opportunities. So don't forget that this is just a small, tiny part of your life. Don't make it your whole life. I think.
Absolutely. I think great advice for that piece of it as well. So I think we'll be bringing you back, and in this series, we'll be talking about, observerships related advice. We'll be talking about application, interviews, networking, research, of course. We cannot talk enough about research, and we are biased towards it as well. And probably talk regarding, the personality traits and what you can do, would be the mitigation strategies in detail for that matter. For those who are watching, please like and subscribe to our channel. Otherwise, you're going to miss out on this whole series of interviews. Go ahead, Dr. Parthe.
Dr. Kashyap, I had a question for you at this stage. So it's a long journey, and as me and Priyal both mentioned, that we do need guidance and mentors to help us out along the way. You, as a mentor who has been in this field for 15 to 20 years, do you have a program that can help students or someone who is not accustomed with the system to help them go around with this? Does GRRSP have that yet?
So that's a good question. I think we are building up this vertical, and hopefully you guys can help run the vertical and help out with that as well. There, not only just research mentoring, this could help people with talking to people who have gone through this journey. They've been successful, high scorers, and then they can share advice and kind of handhold. Time is limited. Anybody will come in this roles and things, they will be busy in their lives. But if people uh, can value the time given by mentors, limited time given by mentors, and then seek out help, I think that will be hugely helpful. And then it has to be compensated in some form, and so on and so forth. So hoping that that can add to those who are coming in line. They don't have to be without guidance. It can take you a lot of time to do the same thing if you don't have any guidance, versus it can take you less time, a little bit less efforts for that matter. So we're trying to see if we can fill that gap in future. So thank you for asking that. Those who are watching, please like and subscribe, and then wait for the series to drop in. We will, I think, probably every week we'll be uploading a video on these matters. So thank you for watching, and thank you for being here, guys.
See you next time.